So let's talk about this question that we just posted. The one that you would see first in the surgical ICU. So a prioritization question. So we're looking for Ask GRAPH. Ultimately, we're actually kind of looking for AASH, right? So Ask GRAPH, if you don't know the mnemonic, it is on our YouTube channel. You can go ahead and watch that. AASH, I'm going to go ahead and post a short on AASH, what it is. AASH is a portion of Ask GRAPH, but we've kind of narrowed it down post-op, post-procedure. And we narrowed it down to 4 of Ask GRAPH, which is airway, altered mental status, sepsis, and hemorrhage. So because we're dealing with somebody post-op, post-procedure in all these situations, we're going to look more for AASH than we are of Ask GRAPH, but we always keep Ask GRAPH in the back of our mind. So using the method, we're going to start with the letter D and not make a decision and just compare it to C and see which one we're freaking out about more. Because once we eliminate one, we're not going back to it. So D is a 66-year-old post-op thyroidectomy who is reporting tingling around the mouth and hands and has a calcium level of 7.2. So calcium is low, post-thyroidectomy. Okay, we're thinking maybe they remove the parathyroids, maybe they have that Trousseau sign or that chopstick sign, but nonetheless, we're not making a decision. Let's compare it to letter C. A 72-year-old post-op hip replacement patient who is alert and oriented, but reporting new onset shortness of breath and chest pain. Now, between the two, the hypocalcemia, I'm not necessarily freaking out about compared to somebody that possibly has a PE going on right now. So what are we going to do? Well, between the two, I'm probably going to choose C over D and eliminate D. Does that mean we're coming back to it? Absolutely not. Absolutely not. So now we're going to compare C to B. B is a 49-year-old post-op laparotomy patient with NG tube, now reporting sudden increased abdominal pain and a heart rate of 110. Again, I'm still more concerned about the PE and C over this person with the NG tube with some abdominal pain and a little tachycardia. So I'm going to go with C over B. Now I'm down to 50-50. So if you're using the method and you're looking for AASH or Ask GRAPH, you're going to see that you're going to get down to 50-50. And a lot of people say, well, wait a minute, Dr. Z, I always get down to 50-50 and I choose the wrong one. If you do that in any situation, in any question that you do, and you get down to 2 answer choices and you can't make the right decision, it's content. So there is no getting around it. There is no trick on this exam. Board exams are going to be black and white. Remember that. So now we're down to C and A. A is a 58-year-old post-op coronary artery bypass graft, so a CABG, whose chest tube output has increased to 150 ml per hour in the last hour and a drop in blood pressure to 90/60. All right, so you're telling me in C, you have airway because it's a PE, shortness of breath and chest pain. And in A, we have hemorrhage because this patient's chest tube drainage should not be 150 ml in the last hour with a BP of 90/60. They're saying this patient is hemorrhaging. Now, wait a minute. This is where you have to understand, who do I have more time with and what more can I do? So, or you can reword it, who do I have less time with and what more can I do? And I kind of like the latter, who do I have less time with? All right, let's think about this. If we're dealing with a patient that has a PE, yes, we are talking about airway, but is this patient's airway completely compromised or do they just have a PE? They just have a PE. If their airway was 100% compromised right now, they would not be alert and oriented. So what are we going to do? Well, with a PE, we've probably got to get them on anticoagulants, give them oxygen, take care of their pain, so on and so forth. We have more to do with this patient with a PE, whereas a patient with a coronary artery bypass graft, that means that their graft is hemorrhaging. That tiny little coronary artery, all those vessels or whatever, however many vessels were replaced, are now hemorrhaging, and they're actively hemorrhaging. Who do I have less time with? I have less time with the person that's hemorrhaging from the coronary arteries. The patient with the PE, I get it's airway, but they're alert and oriented, and I still got to give them oxygen. I've got to get them on blood thinners. You see, I've got more time with that person. With the person with the CABG that just got sewed up, their sternum got wired shut, and now we might have to go back in and figure out why they're hemorrhaging. I don't have a lot of time with. Take them straight to the OR. So you see, there's a lot more sense of urgency on exactly how to approach this. So I hope this explanation helped you. Those of you that chose C, good job on identifying Ask Graph. But I want you to take it a step further. Again, ask yourself, who do I have less time with? And what more can I do? And now that you found 2 of Ask Graph or 2 of AASH in the situation, I want you to ask that, because again, you might get 2 or 3 or even all 4 may fall into AASH. And now you've got to ask yourself those 2 vital questions. Hope you enjoyed.